Hi, and welcome to my next video about adult content creation. This video is going to cover everything to do with sexual health, which doesn't only apply to adult content creators or sex workers. I think a lot of it will be applicable to quite a wide audience, but I'll obviously be focusing what I'm talking about specifically on people who are involved in the world of adult content creation. As always, if you have any feedback, comments, or questions about what I've spoken about in this video or in any of my previous videos as part of this series, then I always really love to hear your feedback. So please put them in the comments or send me a message. And if you prefer to see me with fewer clothes on, not talking quite so much, then have a look at some other websites where I post different kinds of videos. I'll start off by explaining the structure of this video. I'm going to be dividing it into 4 different kind of broad sections. The first one will be stigma, then different STIs in general, then testing, and then prevention. As I say, those are all quite broad categories, but I just wanted to have a rough outline of how to structure the video. And then under each of those headings, we'll sort of discuss various things. And if there's anything that doesn't quite fit into one of those, then I'll just kind of sweep it all up at the end. So I wanted to start by talking about stigma because I think a lot of people have quite a visceral reaction when we talk about sexual health or STIs. And I suppose I want to start off by saying that when I talk about sexual health, it's not only about having an STI or not having an STI or about prevention or about testing or anything like that. I want to come at this from more of a kind of holistic point of view, where when we talk about sexual health, it's also about mental health and about boundaries and things like that. It's about feeling good in yourself and enjoying sex. I suppose in this video, I'll be covering a lot of more kind of medical focused approaches to sexual health, which is why I wanted to start off by adding this caveat that sexual health is a lot more than just that. Obviously, when it comes to adult content creation, things like boundaries and mental health are really important. But in terms of the kind of advice or information that I'm going to be putting out for this video, I want to offer kind of practical medical things you can do to help prevent STIs or the kind of things that you might want to expect when you're arranging a collab with someone. And those are inevitably more about testing and prevention and doxypep and things like that. So I just wanted to start off by saying that when we talk about sexual health, it's more than just STIs. I wanted to say as well that I think there is a big stigma around sexual health when it comes to sex work because there's a misunderstanding or a misconception that sex workers have higher rates of STIs than the general population. In my experience, we test a lot more frequently. We have more open and honest conversations around testing. We have more knowledge and understanding about STIs than most people do. Sometimes when someone finds out that I'm a sex worker, one of their questions is, but how do you stay safe? And the implication is, how do you avoid STIs? As if we're sort of disease ridden or something like that. And I really do think that some people believe that about us. For me, having an understanding about sexual health and trying to look after my own sexual health and the sexual health of the people that I have sex with is a part of my job, as is pushing back against that kind of stigma and judgment that comes with misunderstandings about what the job involves. I think sometimes some of the stigma comes from just not understanding what STIs actually are and not realizing that sometimes getting an STI every now and then is part of life, a part of being sexually active, and that they're usually very treatable, not serious, and not really anything to worry about. That doesn't mean that you shouldn't do what you can to try to lower the risk of getting something, but it just means it's not always that big of a deal. And I think that kind of approach and that kind of understanding about STIs is more common in sex work than it is for other people, which is why I really want to kind of refute this narrative that sex workers have poor sexual health, because I think we have much better sexual health than most people. With that as well, something I think is really important to include in this section about stigma is how to disclose to someone else if you have an STI. As I said, sometimes this is just a part of life and a part of filming. Even if you ask for certs with the window period between potentially being exposed to an STI and then it showing up on a test, that can mean that someone can test negative for something, but potentially have caught something just before that and it wouldn't show up on the test. So you can obviously do what you can to limit the chances of that happening, but it's not going to be 100%, and that's something you just have to accept. So if you test positive for something and you need to contact people who you slept with recently, then just sending a text to say, sorry for the bad news, just want to let you know I tested positive for this, you'll need to get tested as well, sorry for the inconvenience, I hope it's not too stressful for you, something like that, that shows sympathy and understanding of their situation, which is similar to the situation you're in yourself. And if you receive a message like that, the correct response is, thank you so much for letting me know. I understand that receiving a message like that might make you feel angry or upset, but that's something that you should navigate on your own time and not in conversation with the person who's disclosed that to you. I think you're entitled to feel upset about potentially being exposed to an STI, but as I say, this is a risk that comes with being sexually active. They're doing a favor by letting you know about it. getting angry at them about it won't prevent you from getting an STI in the future. It will just mean that in the future, people will be less likely to tell you, which would be a lot worse. I understand that it's really not nice if you can't work for a period where you need to wait for results or if you need to get treatment. But again, I'm sorry, that's a territory of the job. It's a territory of being sexually active, and it's not something that you should express anger towards the other person about. Now, we couldn't discuss stigma when it comes to sexual health without talking about HIV, which I think anyone who's watching this, who's living with HIV, knows better than anyone about this very specific kind of stigma that comes with that territory. If you are HIV positive, I can't speak on the very specific and individual barriers that you might encounter, but I will say that many performers are HIV positive and that the understanding around U equals U and PrEP is pretty high in the adult industry. If you're not familiar with this, basically this means that if someone is taking medication and living with HIV, they have a status known as undetectable, which means they're not able to pass on the virus. This is known as U equals U, which is undetectable equals untransmissible. I filmed with many performers who are living with HIV. For me and for many others, it's a complete non-issue. They're undetectable. I'm on PrEP anyway. I think if you're someone who's thinking about starting out in adult work and is worried about your HIV status potentially being a barrier, personally, it's not something that I would think you have to worry about too much. So my approach to this is I think about myself. I think about myself getting tested regularly, which I'll go into in more detail later. I do what I can to reduce my personal risk of getting anything and also passing that on to anyone else. Because obviously I'm thinking about myself, but I'm also thinking about the sexual health of my boyfriend and the people I film with and my clients. And obviously I need to make sure that I'm doing what's right by all of those people. But I think it's possible to say at the same time as me doing everything I can to reduce the risk of getting an STI, I also want to reduce the stigma around it and avoid reinforcing some of those stigmas. And this can come up in really small ways to do with language. For example, if before filming I ask someone about testing and they get defensive or say I'm clean or push back against the need to share results before filming, for me that's a red flag, and that would really, really discourage me from filming with them at all. Clean is not the right word to use in this context. It implies that anyone who has an STI in any form is dirty, which obviously is not the case. I would just say everything was negative. I think saying everything was clear is okay. The thing is, I recognize that some of the stigma is really ingrained. And if you grew up in the 80s or 90s or early 2000s, where there was so much of this language around HIV and AIDS, it can be really ingrained and hard to push past that mindset of it. But I think the first step is recognizing that you're thinking about sexual health in that kind of judgy way and just trying to change your mindset in small ways. So if someone asks you about testing and your first reaction is to think, why are you asking me? Why would you think that I'm the sort of person to have an STI? Just recognizing that that's been your reaction and thinking, why do I think that? Why do I think that that would be a negative thing? Why am I trying to separate myself from the kind of person who I imagine might have an STI? Literally anyone can get an STI. If you're sexually active, you can get an STI. If you have only one partner in your whole life, you can get an STI. If you do no penetrative sex, you can get an STI. If you just share sex toys, you can get an STI. But I'm not even talking about the kind of sexual acts which are more risky or less risky. I'm just talking about the fact that having something or not having something says absolutely nothing about your character. Get tested, do what you can to protect yourself and protect other people, but just try to be understanding and non-judgmental about all of these conversations. Okay, that's all I have to say about stigma for the time being, although I'm sure it will come up in little ways throughout the rest of the video. The next section is going to be talking about some of the main STIs and some of the less common ones which aren't usually tested for. So in a basic but full sexual health screen, which is what I normally get, you'll be tested for chlamydia, gonorrhea, syphilis, HIV, and normally hepatitis. For the swabs, that would be in 3 locations. So throat, rectal, and then either a vaginal swab or a urine sample, depending on your anatomy. And then the blood test would cover syphilis, HIV, and hepatitis. One of the STIs I often get asked about is MGen, which isn't covered in a normal full screen. I get most of my screens done at Dean Street in central London. And as a rule, they don't test for MGen. You can't even request it. So the official BASH guidelines around this are that because most infections are asymptomatic, if they were to test for this, so many people would test positive, they would end up over prescribing antibiotics, and that could lead to antimicrobial resistance. So that's the kind of reasoning behind it. If you have symptoms, that's something to then speak to them about. I have spoken before to creators who have asked for this test, and what I'd recommend is if you're going to film with someone who is asking for this specific test, then you'll probably have to pay for it privately. From what I could see online, it was around £200 a test. What I'd recommend is if you know a few people who require this test, just try to organize it so you can film with them, all in the same week after you've got your results back from it and not have to sort of pay over and over for it. Personally, this is not something I test for. I'm sort of going by the BASH guidelines. I don't have symptoms of it. And I also am not willing to pay hundreds of pounds each time to get tested for it. Again, this is something you have to kind of just decide for yourself about what you're comfortable with and what your risk level is about it, and just kind of go from there. Most people kind of know about the main STIs, but there are a lot of kind of variations and things like that. A lot of them are less common or less symptomatic. If you're getting symptoms that aren't showing up on a basic screen that covers all of those things I just mentioned, then you should speak to your clinic and they should investigate and try and find out what's going on and test you for other things. It could be BV, which is bacterial vaginosis, if you have a vagina. It could be a UTI. It could be a whole range of things, which could just require a bit more investigation. I think I'll leave it there with the different kinds of STIs, because some more of that will come up as we go into the next section, which is about testing. How often you test is up to you. As a standard, as far as I'm aware, most sexual health clinics in the UK, which is where I'm based and the kind of services that I'm familiar with, usually offer every 3 months as standard. At Dean Street, if you're a sex worker, you can ask for gold membership, which allows you to get tested once a month instead. Personally, I get tested every 3 weeks, and I do this by alternating in-person tests at Dean Street with home testing kits using shl.uk. I realise this seems quite frequent and isn't necessary or possible for everyone who'll be watching this video. If you're not having as much sex, if you're not filming as often, then you won't need to get tested as often. Also, if you're living in an area that isn't as well served as London is and doesn't have as much funding, then I understand that it won't be possible to get tested that often. Some areas of the country take 2 weeks to send your results back to you. A lot of STIs take a few weeks to show up on a test, so that could make it a little bit confusing. As well as wait times, I know that some clinics only text you if you test positive for something, which isn't always great if you need to share results with people to show that you're negative for everything. And yeah, I find that pretty annoying. I think that kind of anxiety or nervousness of like waiting to potentially get a text or not get a text is kind of strange. And I understand sometimes it's just an outdated system, but how difficult can it be to update the system to just automatically send a text to say everything was negative? I guess quite difficult because a lot of places still do it, but yeah. I know as well that some clinics only have like a phone line. Had this with Scottish creators specifically, where in order to get their results, they phone up, put their details in, and a recorded message says that they're negative for everything. Again, not great for sex work and content creation because it's quite difficult to share that. I guess you could kind of record it and send the recording of it. Personally, I think a text would be better. But again, it's just these systems, this is how they do it. And sometimes you just have to navigate that and make decisions about what you're comfortable with and what you're not. Dean Street is great. Normally the results are back within 24 hours, usually the same day actually. And you can also get certs from there, which now cost £15. So when you go to get tested, you pay on the day, you show your ID at the point of getting tested. And once your negative results will come through, you send an email and they send your certs back to you through email, which has your name and date of birth and all your information on it, and then the list of things you tested negative for. So that's a kind of more official way of showing what you were tested for and the fact that you're negative for everything than necessarily just showing screenshots of the texts. If you're going to be working with any studios, any kind of reputable studios will ask for STI results and they'll normally ask for proper certs. The screenshots wouldn't be sufficient. And in general, neither would the home testing kits, as far as my experience goes. That's just something to be aware of. For me personally, if I'm filming with someone, I'm normally happy with screenshots. It's just something to see that they've been tested, and it needs to say what they were tested for and the date and their name and things like that. But as long as all of that's there, it doesn't need to be an official cert, because I understand that not all parts of the country offer that as a service. Sometimes it's really expensive. I do think there has to be a balance between being realistic about what to expect from people and making sure that I'm doing everything I can to reduce the risk. The home testing kits I use as well are really good. So as I said, shl.uk. There are other home testing kits around the UK. That's Sexual Health London. So the other ones would just be sh.uk. And then you just do the whole test at home. There's a little sort of finger prick thing to do the blood, which most people hate. I'm kind of used to it now, so it doesn't bother me that much, but it can sometimes be quite difficult to get the blood out. So you really have to kind of sometimes push from up here and really squeeze your finger and get it out into the little tube. If you have a UK address and a UK phone number, then you can just do that online. And with the London ones, you have to have a London address, but it doesn't actually have to be your own personal address. So if you're visiting, you live elsewhere in the UK and you want a sort of a quick and free service to get tested, then you can use a friend's address, come down, visit, pick it up, and you can post it from anywhere in the UK. So actually all you really need is UK phone number. So again, if you're visiting from elsewhere, then just get an eSIM. You'll have a UK phone number. You'll receive your results that way, also by email if you want. Once you request the kit, it normally arrives within about 3 days, and you send it off. And in my experience, the results come back within 3 days as well. So very quick. The thing I really like about the home testing kits is that when your results come through, you get a link to a kind of online portal, and then you can create a shareable link from that to send to other people. So that's a really nice way to share your results with people that you're about to film with. When you're ordering, you will do a questionnaire about what kind of sex you're having and what kind of tests you require. And again, that'll be, well, for me, it's the 3 swabs, so vaginal, rectal, and oral. I should say at this point as well that I'm using quite clinical, like medical language when it comes to genitals. Obviously, you might not use the same words. I'm speaking to what I assume is quite a queer audience, and I understand that, yeah, you might not use those words about your body, so just take what take what is useful and ignore what isn't. I'll be saying vagina and penis and things like that. Sometimes Dean Street has asked me like what language I want to use about my genitals. They sometimes say front hole, I think, which personally I'm not keen on, but it's nice that they ask. I say vagina though. The other thing to mention about the SHL kits is that if you're a sex worker, you can get them more frequently. So again, it's the same rules as Dean Street, that you can only actually request for a year, so every 3 months. But if you're a sex worker, you can get them once a month. And this should happen automatically when you answer the questions you're going through when they say, do you accept money for sex, or whatever it says. If you're a content creator, just say yes for that. And you should automatically get those more regular kits. If you don't, just send them an email and ask for it, and they should sort it all out for you and sort of update that on your system. There are some things that clinics don't automatically test for, things like genital warts, herpes, pubic lice, or crabs. I would say that if you have something like that, you would know about it, and you should still go to the clinic. They can offer you treatment and support, but that's not something that would be covered in a general test. So again, specifically to do with adult content creation, there's no centralized system that's keeping track of who's been tested and who hasn't. In the US, I know they have the PASS system, which I don't actually know that much about, but as far as I'm aware, the way it works is that you upload your tests or whatever, and it shows to other people that you're all clear and all ready for filming, but doesn't give away too much personal information. And it might say that someone has tests that have expired and things like that, but it just means you don't need to share very much information, but it's all kind of centralized, and you can share with someone that you're ready for filming without too many concerns around what other data you're sharing. There's nothing like that I'm aware of in the UK, so it's up to the individual to manage that, ask for results, speak to people you're filming with about what tests you require and what that kind of window period is that you would prefer, things like that. It just means it's up to you to keep on top of it, to get tested regularly, to book your own tests, to make sure that you're sticking to a schedule that you're comfortable with and that your filming partners are comfortable with. My usual opener when speaking to someone about filming is to mention this right at the beginning. So I just say something along the lines of, my last test was on the whatever date it was. I get tested every 3 weeks. I ask for similarly recent tests from everyone I film with. What's your testing schedule like? And then that opens up the conversation. They can say, oh, it's actually been a little while. I'll book one in and we can film after that. Or, oh, I got tested, a few days ago. So perfect. We can plan for, tomorrow. I think it's just quite good to be clear from the get-go that recent results are a non-negotiable, and then the conversation can kind of go from there. It's really up to you what you decide is important and what you require in terms of the timeline of it, the proof, things like that. But I only film with recent results. If you've had syphilis before, then this stays in your blood and means that if you just get like a normal syphilis test, then it will show up saying that it's positive, even though it might be just the old infection. There are ways to test for whether it's a new or old infection, but sometimes you have to specifically request those kinds of tests. Otherwise, it will just show up as positive and you won't know whether that's old or new. I actually didn't know about this. I knew that it stayed in the blood because every time you complete the SHL questionnaire, it asks you if you've had syphilis before. And sometimes in clinics, they ask you that as well. But I hadn't realized there are specialized tests for finding out whether an infection is new or old. I just found that out when I was researching for this video. So what's known as an RPR test tests for antibodies, and that can help distinguish whether that infection is new or old. So there are ways to do it. So if you have syphilis and you've had syphilis before, then it's still possible to prove to someone that you don't have a new infection. So I mentioned Dean Street, which is the main clinic that I go to. I've also been to Falcon Road in Clapham Junction, and Mortimer Market Centre, which is Warren Street area. From a specifically trans point of view, I would say Dean Street is one of the best, if not the best. They have 56T, which is Wednesday evenings, and it's a clinic specifically for trans people. And there they can offer not only sexual health screening, but also things like advice about birth control and hormones and stuff like that. You can also book your smear test at Dean Street. So if you're a trans person who, like me, has a cervix and doesn't feel comfortable going to their GP for things like that, then Dean Street can help you with that. I got my smear test done at Dean Street when I turned 25, and again when I was 28. And for me personally, I feel a lot more comfortable going there, where I know that the person who is conducting it is like definitely an ally and is a lot more kind of understanding than someone who has never met a trans person before. I don't know about the other clinics in London or in the UK. I used to live in Manchester and I had pretty good experiences there. The systems in Manchester were very underfunded, as are most of the other systems in the UK, apart from London, apart from Dean Street, really. I mean, even Dean Street is struggling for funding now. That's why they've started to charge for certs. Sexual health in general is underfunded, but of all of them, Dean Street is probably the most funded. Anyway, so what I was saying about Manchester is that sometimes it could take a long time to get an appointment, or it was difficult to book an appointment. The way it worked when I lived there was that you had to log on at a very specific time in the morning and book an appointment, and sometimes they would just go immediately. And it would also be a long wait to get results. But the experience I had with the actual nurses by the time you were in the room with them was always really good. They were always very trans aware, and I never had any issues in that area. At Falcon Road, so that's the one in Clapham Junction, I had a weird experience where I'd been contact traced for gonorrhea. So I was going to get like a test just to prove I didn't have it. And she started asking me like who had wanted me to transition. And I know it sounds stupid now, but when I was sitting there, like I didn't fully understand what was going on. I couldn't, like, now I'm looking back at it and I was like, oh, she was transphobic. Like she was trying to, I don't know why she picked that moment to have that conversation, or why she thought that it was appropriate. Obviously it wasn't, but I don't know. She was obviously down some kind of like transphobic rabbit hole online. And then she was like face to face with a trans person and she was trying to prove something to herself, or I don't know. I guess she wanted me to be like, my parents forced me into it or something. I don't know. Or for me to say like, oh yeah, I used to be a lesbian, but then like I started watching videos online and decided that I wanted to be trans instead. Like, I don't know. But yeah, in the moment I was just like, no one, like my parents were supportive, but like no one encouraged me. I was sort of advocating for myself from a very young age. Yeah, obviously she does not represent the entirety of Falcon Road. That was just one person, and like my other experiences when I used to go there were fine. So I guess I'm bringing this up not to criticize Falcon Road specifically, but just to say that your experiences may vary, and that's why it can be nice to go to a clinic like Dean Street, which specifically positions itself as being trans inclusive. And that doesn't mean you're never going to get anyone who says something ignorant or uses the wrong phrasing or asks you a question which you find inappropriate or just hasn't understood something. But in general, I feel like if you can find a clinic that is at least trying, then that's always good. Sometimes it is just the computer systems that are old. So when I go to Dean Street Express, which is where I get my regular tests done, the way it works for most people is you walk in, you scan your barcode, which either you have with you or they can print off for you at the screens. And then you sort of answer some questions on the screen, and then that prints out the barcodes, which then go with your tests, which you then go and do in the toilet. But for me, because the way I answer the questions, it's things like, I can't remember exactly what it is that sort of disqualifies me from it, but it's something like, it basically assumes that everyone's cis. So it asks me if you're a man who has sex with men, I think, or if you do anal or something like that. And it's like, well, okay, well, I don't do anal, but I still want an anal swab. And I'm a man who has sex with men, but then I think it would automatically give me a urine sample, whereas I need a vaginal swab. So it's things like that. So, but I mean, that's fine. It's just an old system. So now when I go in, I go to reception and I just say, the computer prints out the wrong barcodes for me. Please could you print them out for me instead? And they just print out the barcodes themselves. So I don't need I don't need to scan my personal barcode to do it at the machine. They just print out the labels for the sort of test tubes for me. For me, that's not a problem. Like the receptionists are really friendly there. I always have a good experience there. So it's just a small thing to note that sometimes it's just the systems that are old, but once you're actually speaking to a person, it's pretty good. It would be nice to see an update in those systems, not only at Dean Street, but everywhere. But, you know, it sort of does what it needs to do. A lot of GPs also do offer sexual health services. You don't necessarily need to go to a specialized clinic, but in my experience, so I can't remember where I was living at the time, but I went to a GP and they had a sexual health nurse who came in once a week. and she was booked up, I think, like 6 weeks in advance. So if you want to get tested regularly, that's kind of useless. Also, the thing that I like about sexual health clinics is that your medical records there are completely distinct from your GP records. I don't necessarily want on my GP, like on my medical records, that like what I've been tested for and things like that. It's nice to have it separate. If you're watching this as a trans person, you may be like me and not have had always the best experiences at your GP in terms of trans stuff. So in that case, sometimes it's just nice to not have to keep going back to your GP for things like this and to go to a place that feels a little bit more inclusive. And finally, when it comes to testing, I want to say that false positives and false negatives and things like that are rare. False negatives in general are more likely to be because you haven't done the test right, rather than because something's gone wrong in the actual lab. So that means with a swab, it has to go right to the back of your throat, or it has to go, right up in and round a little bit. As I said, though, there are other STIs which don't always show up on a test. And I think sometimes for trans people who are really under-researched, or for example, if English isn't your first language and you're trying to get tested or treated for something, or you feel like you need more investigation or more help with something and you're not getting it, sometimes that can be a real barrier. So it might be that all your tests are negative, but you know that something's wrong. And I really hope that if you're in that situation, you find a way to advocate for yourself and just keep pushing, because sometimes that's what you need to do. And I really recognize what a privilege it is to be white and a man and cis and an English speaker in that situation where you can say, no, keep doing more tests, something's not right. Obviously, I'm not cis, but I do feel like I benefit from a lot of that privilege, because I've been in situations before where I felt like something isn't right and I've had to ask for more or almost be on the verge of demanding more. And it's unfair that sometimes that's how medical systems work. But again, yeah, if you're in that situation, and especially if you're in a marginalized group, I hope you are able to advocate for yourself and ask for what you need. And if there happen to be any medical professionals watching this, then please listen to people when they're trying to advocate for themselves. I mean, I'm sure anyone who is a medical professional who's watching this already knows this, but it can be really anxiety inducing to be in a medical setting with a medical professional, feeling like something's wrong in your body and struggling to articulate that, or struggling to feel like you're being heard. And there can be so many barriers to that. And sometimes it's just like you feel like the doctor doesn't like you, or you're struggling to convey something with the right tone, or just the vibe is off for some reason and you feel like you're not being heard for that reason. I would love it if people in the medical profession could look past some of those things and try to listen to what the person is saying, rather than necessarily thinking, why are they getting angry, or this appointment's taking too long, or something like that. I feel like for most people, I don't need to even say that. It's obvious, and it's, you've done your training and things like that. But I have been in situations where I feel like that's not happening, and it can be pretty difficult. I'd say my experiences in that area have been less to do with sexual health and more to do with being trans when I was growing up, and speaking to doctors who I felt were patronizing and often cruel. So I think really that's what I'm thinking of. That's what I'm invoking when I'm saying this in a sexual health context as well. Okay, and now finally onto the last, or potentially second last, depending on what we come to at the end, section, which is prevention. So there are a lot of ways to prevent STIs, and as a sex worker, I feel like this is really my wheelhouse. The first one we'll talk about is PrEP. So if you're HIV negative, this is something that you can take either daily or event-based. The first thing they'll do is test your kidney function to make sure that you're able to process it. With PrEP, you can take it daily or event-based, which means just taking it when you have sex. And there are different rules and guidelines based on the timing of it and things like that. There's basically a choice of how you want to take it and what works best for you. For me personally, I prefer to take it daily because I already take multivitamins and birth control and things like that. So it's easier to just add it to my pill collection each day. Also, if you are going to get any side effects from it, normally if you're taking it daily, within a couple of weeks, those will wear off. Whereas if you take it event-based, you might experience that every time. So that was another factor in my decision to take it daily. Actually, the main reason I started to take it daily was that at the time, the advice was that trans people could only take it daily because there hadn't been any research into whether it was effective if you take it event-based as a trans person. As always, and this will come up again and again in this video, and already has, the research into anything to do with sexual health for trans people is practically non-existent. We're just rarely considered. And actually, I say trans people in general, it's trans men and other people with cervixes, so cis women as well. The focus is normally on cis men who have sex with cis men, and trans women are sort of caught up into that because they have penises and are considered high risk in the same way that men who have sex with men are. But it just means that as a trans man with a cervix and a vagina, I normally have to wait a few more years to find out whether these prevention methods and treatments are as effective for me as they are for a cis man. Often the conclusion is that yes, they are, but I just don't know that at the time. It would be really amazing to see more thought put into that from studies, like from day one. Can it really be that hard to just include everyone in the studies? It might be a little bit more complicated, it might be a little bit more expensive, but is it really more complicated and expensive than having to redo the whole study like 5 years later to find out whether the conclusions you drew from that first study are applicable to everyone? I don't know. For me personally, it's annoying because I feel like I'm always looking into this and researching this and trying to do like the best thing for me. And it's actually quite difficult to find out what the actual medical advice is because the research just isn't there. I get my prep from Dean Street. There's also digital prep where you can fill out some information online, you complete a kidney function test and send that off, and then you get prep delivered to your door, which is pretty cool. It's all free. There's also vaccine prep, which the NHS is starting to roll out for people who can't access oral prep for a variety of reasons, but it's not super prevalent yet. This is relatively common in the US, I think, and they're kind of gradually increasing the time period which they say it's sort of effective for. But it's definitely not much of a thing yet here in the UK, but I feel like over the next few years, we'll start to see more and more of it being offered. It sounds pretty cool. I mean, for me personally, it's not that big of a deal for me to just take an extra pill, as I say, with my morning pills. So I'm not like massively bothered about getting vaccine prep, but it could be a game changer for people who have difficulties taking oral prep for some reason or have difficulties accessing clinics. As I said, digital prep, sort of the home delivery thing can be a good way around that. But yeah, there's a lot of reasons why oral prep might not work for you. So vaccine prep could be something that is worth considering or looking into for when it starts getting rolled out a bit more. Oh, I should say as well about the different ways of taking prep, like, daily or event-based, and there's different ways of doing event-based. They're all equally effective. If you do them correctly, which again is a real sort of important point, if you do them correctly, then they're all equally as effective. If you're not on PrEP and you're HIV negative and you worry about being exposed to HIV, then within 72 hours, you can take PEP, which you can get from A&E and sexual health clinics. So you can normally walk in and just ask for it. So that's PrEP, which you take as a preventative before, pre, and then PEP, which is post-exposure prophylaxis, which comes after. PrEP should always be your first port of call rather than PEP, because PEP you have to take for a whole month and should really be more of a kind of emergency situation where you've been exposed and you weren't prepared for it. Maybe you're taking event-based and you had an encounter which was unexpected, then you can take PEP afterwards. And now we're going to talk about my favorite topic, DoxyPEP. So doxycycline is the antibiotic which is used to treat chlamydia. If you test positive for chlamydia, you take a dose in the morning and evening for a week. And when used as DoxyPEP, you take one dose after a sexual encounter within 72 hours, although the closer to the sexual encounter, the better. And it reduces the risk of catching a variety of STIs, mostly chlamydia and syphilis. Let me show you mine. So that's the box. It looks different depending on where you get it from. So this is the one I get from the sexual health clinic. But then before it became possible to get it prescribed within the clinics, I was buying it online in bulk from kind of generic medicine type websites. And it looked like this. I mean, it's the same medicine. It just looks slightly different. So I think DoxyPEP is great. I think it's a real game changer. I'm a real advocate for people taking it if they would like to and if they feel like it would improve their quality of life. There's a lot of judgment around it in terms of worries about antimicrobial resistance, stomach problems, but also kind of judgment around sex in the sense that people say, oh, it's going to lead to more unsafe and risky sex and things like that. It just feels anti-sex. It feels homophobic. This medicine is used to treat acne, and for that, people take it every day. It might be something you might have taken if you're going to somewhere that has high rates of malaria. And again, that's taken daily in that case. It's exactly the same medication. And there wasn't the same kind of fear-mongering about antimicrobial resistance when it was being used for acne and malaria. Those conversations are really starting to be ramped up now that it's being used to enable gay men to enjoy sex more, primarily. I want to bring this back to this idea from the beginning about stigma and this idea of a holistic approach to sexual health. DoxyPEP isn't only about reducing the risk of catching syphilis and chlamydia. It's about being able to enjoy sex in a way that reduces anxiety. If DoxyPEP is going to improve your mental health and improve your well-being, then that's part of sexual health and is really important. That's not something to be ignored. That's part of this whole conversation for me. Even just from a sort of scientific and medical perspective, that's really important. It's really worth bringing into the conversation and factoring in when we're talking about how effective it is. It's not only about prevention of STIs, it's about personal well-being. If we're asking, does it work? Part of that question should be, does it work in what way? I want to go into a little bit of detail about the studies on how effective DoxyPEP is at preventing STIs for people with vaginas, because, as I said, the research is lacking. But there have been some studies which have shown pretty promising results. So there was a study published in 2023 which showed that DoxyPEP didn't really work on cis women. And obviously, as a side note, trans men could be different, but there's just no studies there. So we're going to talk about cis women because in terms of genitals and anatomy and the kind of concentration of DoxyPEP in the vagina and how effective that would be at preventing an STI there, some of the conclusions are possibly the same, but again, we don't know. So I'll talk about cis women because that's who the studies have been done on. So yeah, this 2023 study found that it didn't really work, but then the literal conclusion of the study was that they hadn't been taking Doxy as they were directed to. And that's actually a really important finding, because if clinicians are saying, take this to prevent STIs, it's kind of useless if people are hearing that and they don't trust the clinicians or they encounter issues with it. One thing these women said was that it was causing them to become nauseous and therefore they weren't taking it. It was thought that they were taking it on an empty stomach, which can induce nausea. So that's something to be aware of. I'll go into some more advice and side effects about DoxyPEP in a moment. But if we actually look at the study, even with a really low uptake, it was actually surprisingly effective for people with vaginas. And then since then, there was a study in Japan on female sex workers. And this was Doxy Prep rather than DoxyPEP, which means that these women were taking it every day. So again, that's not completely transferable to the way that we would necessarily use it here, because I wouldn't recommend taking it every day. But this study found that the rate of STIs was significantly reduced in these women. So it was clearly working, even though it wouldn't necessarily be used in exactly the same way if you were to use it as a content creator. It's also been shown that vaginal tissue does build up that high concentration of doxycycline, so that suggests that it would be effective at preventing infection there. But again, studies are ongoing, hopefully. More studies are needed, but I think it's promising. And I will say, from a personal point of view, it's worked for me. I find it really good. And yeah, I take it regularly. Just some little sort of side notes about DoxyPEP. Obviously, can't go into everything. It's a medication. I'd really recommend researching it, looking up any contraindications from things you're already taking, and doing your own research about that. But just a few small things to note. I said about nausea. For me, I drink a lot of water and I normally have it with a meal because it can cause nausea. You should also stay upright for 30 minutes after taking it. And yeah, drink a lot of water just to make sure it's getting flushed through. That can help to avoid any issues with your esophagus. Just a note, if you get really ill with it and you feel ill and you throw up, if you're taking the birth control pill, that won't be effective, so you need to take another one. One of the main concerns people have about it is about antimicrobial resistance. There are a lot of ongoing studies about this, as there always should be with new medication and things that are being rolled out to a sort of broader audience. As I said, though, I do feel like a lot of it is fear-mongering. There needs to be more research into it, but in order for there to be more research, people need to be taking it and being studied on it. It's worth thinking about as well, if taking one dose prevents someone testing positive for chlamydia, that's one dose. Whereas if they had sex with someone who had chlamydia and then tested positive, they would have to take it for an entire week. And I know it's not an easy comparison, and I'm not saying that it completely evens out, because obviously most sexual encounters where someone takes DoxyPEP as a preventative wouldn't necessarily have otherwise resulted in someone needing to take doxycycline for a week, because in most cases people don't have chlamydia. But I do think it's worth taking into account that this is preventing someone needing to take a course of antibiotics for a whole week. Really though, I'm not trying to justify it. I'm not trying to convince anyone. I'm saying that it works for me. Studies are ongoing. Do your own research, look into the science of it. And again, I guess I am trying to convince in some sense, because I just want to bring up again, because I think it's really important that it's not just about your physical health, it's about your mental health as well. If it reduces your anxiety, that is important. Anyway, a few other notes about DoxyPEP. It increases your skin sensitivity to sunlight. I was having a conversation with someone and they said that their uncertainties around taking it were that they have very pale skin and that they were worried about this aspect of it. It emerged that they thought that taking DoxyPEP would gradually permanently increase their skin sensitivity, so that they would just be constantly burning for the rest of their life if they started to take DoxyPEP. This is temporary. All it means is that the day you take DoxyPEP and the day after or something, you should just be really diligent about making sure you're putting on factor 50. That's it. It's not permanent. I also read that some people have problems with DoxyPEP causing yeast infections if you have a vagina. I think it's worth mentioning, because if you sort of notice this is happening to you and you don't know why, and you've just started recently taking DoxyPEP, I'm saying this to potentially make that connection for you. And then obviously I mentioned nausea, but there's also other possible gastrointestinal issues. Normally taking probiotics can solve that. All medicines have side effects. Just do some research, check that it's the right thing for you. And yeah, personally, I'm pretty happy with taking probiotics and using a bit of extra SPF if it means I'm protected against chlamydia and syphilis. I'm just going to put up on the screen now, and I'll link to it in the caption as well, Love Tank's Queer Health Guide to DoxyPEP. They have loads of really good back pocket guides. This one's about Dr. Pep and sort of goes through in more detail about some of the things I've mentioned, but in a lot more detail. So if you want to read about it and you're interested in taking it and you want to do your own research, this is a really good starting point. Another really important preventative method to mention is vaccines. So you can get vaccinated against Mpox, hepatitis A and B, and HPV. Most of these can be done at your sexual health clinic. There's also the Men B vaccine, which can help reduce the risk of gonorrhea. This was rolled out for free on the NHS last year. So now you can get it in sexual health clinics from August last year. Was it last year or the year before? It's been out for a while anyway. Annoyingly, I didn't know that it was in the works to be released for free. So like a year or a year and a half before that, I paid for it at Boots, which you can still do, but there's not really any reason to do that anymore. It's 2 doses, at least a month apart. I paid £110 for each. But yeah, it's free now. So go to your sexual health clinic, get jabbed. I should say it's not 100% effective at preventing gonorrhea. It's between 31% and 59% effective, depending on which study you pay attention to. Obviously, there's a whole variety of factors that could come into that, but it's not nothing. It's better than nothing. There's an obvious prevention method that I haven't mentioned, which is condoms. The reason I sort of left it to the last minute is that I feel like it's usually the first thing that's mentioned when it comes to prevention of STIs for cis-het people. And I decided not to mention it straight away because, one, most people already know about it. I don't think I need to educate anyone about condoms. I guess there's a few things that people might not know, just making sure that, have the size that's right to make sure it fits properly, make sure it's comfortable. If you're finding it uncomfortable or too tight or you're getting irritation, just try a different brand and a different type, a different material, things like that. Make sure you're using the right lube with it, everything like that. But I also know that the reality is that a lot of gay men don't use condoms, prefer not to use condoms. That's fine. Personally, I prefer to have sex without condoms. I think it's more enjoyable. I'm also very happy to use condoms if it's preferred by the other person. But yeah, that's why I've decided to focus more on things like PrEP and DoxyPEP and vaccines rather than necessarily talking about condoms, because you already know about it and you may prefer not to use them for whatever reason. There should be no judgment either way. There's a lot of anti-sex rhetoric around, slutty gay men, blah, blah, blah. No one cares about their health, stuff like that. And I think that's really wrong. But at the same time, there can also be judgment towards people who choose to use condoms. When I started doing sex work, I wasn't on birth control and I only ever filmed and had clients with condoms. And I definitely experienced some of this where, I'll get comments or feedback from people watching my videos being like, oh, gross condoms. Like, I don't know. I understand that they're a turn off for some people, but I guess like most things, sometimes you just don't need to make a comment about it. If someone only uses condoms, then you might not be compatible with them and that's fine. But you don't need to make it that problem. Okay, that covers most of the stuff to do with prevention. I'm now just going to run through kind of stuff that didn't really neatly fit into any of those categories. So I'm going to talk about UTIs. If you have a vagina and you're getting really regular UTIs, some obvious things are making sure that your partner is washing their hands before they put their fingers inside you, not going from anal to vaginal sex, making sure that everything's being cleaned in between that. If you're getting them really regularly, you can try a supplement called D-mannose, which has been shown to be pretty effective at preventing UTIs. I'll also mention birth control. As I said, I am on the pill, desogestrel. It's a progesterone-only pill, so it doesn't interact with my testosterone, and it does have some side effects, but I personally didn't experience anything severe at all. I get on really well with it. I've been on it for about 4 years now, and if you're a trans person reading this and you're thinking about potentially starting on birth control, then I'll link a guide below which runs through some of the options which might work for you. There are others. It's not only the pill, there's the coil, the implant, things like that. Obviously, you need to pick something that won't interact with your hormone therapy. I'll also mention vaginal atrophy, which can be more common for guys who are on T. This is basically like vaginal dryness, and T can cause it. If you're struggling with this, you can try topical estrogen, although that can affect things like bottom growth. Bacterial vaginosis can also cause some of these symptoms, so it's worth getting tested for that. That can also be more common in trans guys, so it's good to rule that out before you try any other treatments. The thing about vaginal dryness is that if you're having penetrative sex, it can lead to little micro tears in the walls of the vagina, which can increase the risk of getting an STI because it could get into your blood more easily. So in that case, use a lot of lube. That's the easiest and most kind of accessible advice I can offer in that situation. I think that's covered most of the stuff. I guess I realized that this video went off on a lot of tangents and wasn't only specific to content creation, but actually was like a lot more broad than that. Obviously, a lot of it is applicable in that situation, but really, this is just a video about sexual health. I'm really interested in this topic. I'm really interested in how underfunding and under-researched some of these things are when it comes to marginalized groups. I just want to reiterate that in this whole conversation, I know I keep going about this, about like this approach to it, about it being about mental health and stuff as well, but I just want to say that, you should be able to prioritize your pleasure as well. So obviously I've talked about boundaries and I've talked about mental health and I've talked about stuff like that, but it's also about physical pleasure. It's about enjoyment. That's also a really important part of the conversation. Like obviously I'm talking about sexual health in a kind of work focused setting, but all of this applies in a personal setting as well. It applies in your personal sex life. If you're using DoxyPep for work, but it also reduces your anxiety when it comes to your casual sex life, then great, great. Good for you. That's really positive, and we should really not ignore that. Okay, this has been another long and rambling video, so I'm going to wrap it up here. But if you have any questions or comments about anything I've said, then I'd really love to hear it. This is a topic which, as I said, I'm really interested in, but it also has a lot of nuance to it. I'm curious to know if there's important things which I might have missed when I've been covering all of this, or if there's certain issues which you feel like I might have misrepresented. I wonder if you're a content creator, what your approach to testing and prevention is. I wonder how you feel about things like boundaries and mental health in the context of sexual health, whether you're a content creator or not. And yeah, kind of anything else that you feel like letting me know about would be appreciated. As always, subscribe so you don't miss any other videos. Follow me across all my other platforms. And thank you very much for watching. I will see you next time.